Caring for people with type 2 diabetes. Type 2 diabetes is a chronic disease that occurs when the body cannot effectively use insulin, causing blood glucose levels to spike. This condition, if prolonged without intervention, will damage many different organs, especially the eyes, kidneys, blood vessels and nerves. Accordingly, people newly diagnosed with diabetes, in addition to following the doctor's medication instructions, should have an appropriate healthcare plan. If you are not sure, refer to the suggestions below. 1. Change your diet in a positive way. It can be said that nutrition for people with diabetes is a top concern. Because any food you consume has the potential to affect blood sugar levels. For peace of mind, you can consult a specialist on how to plan a daily menu. In addition to the above factors, you also need to pay more attention to the problem of balancing nutrient groups through eating a variety of foods. The advice is to cut down on foods high in sugar and flour. Instead, you should add lots of green vegetables between meals to reduce hunger. Regarding the portion size, you should divide into several meals a day to reduce the absorption of too much sugar at once. When eating, it is necessary to eat slowly, chew thoroughly and eat meals on time to avoid sudden changes in blood glucose. For stable blood sugar, a balanced life, you should use more milk specifically for diabetics. Prioritize choosing milk that has been clinically proven to provide adequate and balanced nutrition, meeting the American Diabetes Association, ADA, and European, EASD, recommendations on nutrition for people with diabetes. Closing parenthesis. The product is specially formulated with a slow-release powdered sugar system, so it slows down the absorption of sugar into the blood to help stabilize blood sugar, promote heart health, help lose weight and waist circumference. You can use milk as a whole meal replacement or as a snack. 2. Pay attention to rest time. In the recommendations for care for people with diabetes, most experts recommend that patients should sleep at least 7 to 8 hours a day. Getting enough sleep will help you control blood sugar well, reduce appetite, bring a feeling of relaxation, comfort and improve insulin's ability to work. Conversely, the disease will worsen if you fall into a state of sleep deprivation, insomnia or sleep apnea syndrome. If not detected and treated promptly, this condition will lead to many serious consequences such as cardiovascular problems, especially high blood pressure. To sleep better, set a fixed bedtime, avoid alcohol, beer or stimulants, or think too much. Many people with diabetes share that they sleep better when they step away from electronic devices 1 hour before going to bed. 3. Check your blood sugar. A complete diabetes care plan cannot be complete without checking blood glucose levels every day. This is meant to help patients manage their nutrition, avoid the risk of hypoglycemia or hyperglycemia, which negatively affects health. Moreover, through regular monitoring of blood sugar at home, patients can also adjust their lifestyle and exercise regimen accordingly. With the traditional way of measuring blood glucose, taking a drop of blood at the tip of the finger, the American Diabetes Association, ADA, recommends that patients record their results daily. Because, such information will be very useful for doctors during routine visits. Based on the data that the patient collects, the doctor will evaluate the effectiveness of the treatment and make changes if necessary. Particularly for users of continuous blood glucose monitoring, CGM, devices, which use small sensors mounted under the skin to check the concentration of sugar in tissue fluids or the fluids around the body cells, this machine keeps track of blood sugar levels. After a few minutes, the blood sugar will be measured once. A special thing is that blood glucose data can be downloaded to a computer or smartphone for patients to easily monitor. 4. Avoid sedentary lifestyle. Exercise is one of the things you should do in your diabetes care plan. According to experts, the combination of exercise with a reasonable diet is a very effective way to help control blood sugar. People with diabetes can choose appropriate forms of exercise such as walking, climbing stairs or yoga movements to help balance the body's activities. The suggestions mentioned above are also quite suitable for office workers or those whose work has to sit often and do not have time to go to the gym. You need to note that exercising at a moderate intensity, suitable for the patient's condition, will bring positive effects. On the contrary, if the exercise is not correct, the patient can face a series of risks such as chest pain due to exertion, damage to tendons, bones, joints. The advice is that you should not exercise immediately after the main meal and also do not exercise at a time too far from the meal because of the risk of hypoglycemia at this time. Y is very tall. During exercise, you should bring candy, to prevent the risk of hypoglycemia. Note that diabetics with complications or comorbidities must consult their doctor before exercising. 5. Check your feet. Diabetes causes many complications for the body, most commonly problems in the feet. This is the result of various complex lesions including TON peripheral neuropathy. The patient decreases and gradually loses feeling in the feet peripheral artery disease. Patients are prone to atherosclerosis, blocked, narrow blood vessels that reduce blood flow to the legs. Infections. High blood sugar causes bacteria to grow faster, resulting in foot wounds that take longer to heal because of the cause of sensory disturbances and reduced blood flow to the feet. Patients with type 2 diabetes are prone to conditions such as tinea pedis, onychomycosis, calluses, and foot ulcers, common in places where there is a lot of pressure such as the soles of the feet, the tips of the toes, hooked toes, ingrown toenails, occurs when the edges of the hook poke the skin. From the above issues, to take care of the feet, diabetics themselves and their family members need to check your feet daily for any damage. Keep your feet clean by washing them with warm water and mild soap every day. Pay attention to avoid soaking your feet for too long. After each cleaning, dry your feet, especially between your toes. Always wear the right size, soft shoes, even indoors. If using shoes, the accompanying socks must ensure a good fit and have good elasticity. Trim toenails neatly and regularly.